My name is Jehu Bland. I am a registered dental hygienist. I have been practicing in this profession for approximately 22 years. I currently work as a federal employee for the United States Army at the Army Dental Clinic in Arlington, Virginia. As a registered dental hygienist, my area of expertise is primarily in the field of preventive dentistry. And preventive dentistry, as a registered dental hygienist, my duties usually will require me to take x-rays on patients, dental x-rays. I will spend time doing an assessment of the patient to determine their level of oral health, as far as also to determine their level of being able to properly care for their mouths, more specifically, their ability to implement good oral hygiene. I also perform dental cleanings, and that can vary from a simple dental cleaning, which is just removing plaque and stain, to doing more in-depth cleanings where you're cleaning under the gum. And that's referred to as a scaling and root planing, what people commonly call deep cleaning. So you're basically trying to help to restore the health of the gum tissue and the underlying bone. You also learn how to give anesthesia, so you have to get your patients numb. Some states, I think currently only 3 states don't allow dental hygienists to administer anesthesia. I believe it's Georgia, Georgia, Alabama, and I want to say Mississippi, I believe, are the only 3 states that do not allow registered dental hygienists to administer local anesthesia. But if you practice anywhere else, you will be learning how to give shots to patients. We also will apply like fluoride treatments and fluoride agents to help to reduce a patient's tendency to get cavities. We will apply sealants. We also use certain types of antibiotics to help treat patients that have advanced gum disease. And we work with the dentist to help to develop a treatment plan to help that patient to either maintain or get the health of their mouth back up to proper standard. And that's primarily as a registered dental hygienist. Those are my main duties. As I said, I've been practicing for approximately 22 years. My education, I actually attended two schools. My initial schooling, I graduated in 1998 from Northern Virginia Community College. I earned an associate's degree. I then returned to earn a bachelor's degree from Old Dominion University, and that was in 2015. And my reason for returning for the bachelor's degree was simply 2 reasons. Number one, I promised my mother at some point I would go back and get my bachelor's degree. And secondly, I found out in going through a 4-year program that you do get a more well-rounded education. It also helps to advance your skill set, and it opens up opportunities for you. The difference between the 2-year program and the 4-year program, you both get degrees and you both take the same licensing exams, which the first exam would be a national board that all registered dental hygienists have to take. When I took the exam initially in 1998, because you only have to take it one time, it was about a 7.5-hour test. So you really have to prepare for it. And there are various means and programs that you can pay or apply for, and they will help you to kind of prep you for the exam. So if you pay attention while you are in school in your registered dental hygiene program and you take your prep courses, you should do okay. The second part of it is usually a regional exam, and it depends on the area of the country where you're practicing. Certain states, for example, Florida, you actually have to go directly to the state to take this exam. Other states or areas, there's a regional exam. They give the exam in various states within that region. And that regional exam encompasses a 2-part. The first part is the practicum, where you actually will go and perform a dental cleaning on a patient and have your ability to successfully perform the dental cleaning evaluated to see if you meet standard. The second part of that regional exam is called a jurisprudence. So you have to learn the laws of that particular state, or in the case of DC, the District of Columbia, or if you're practicing in a territory like Puerto Rico or something like that, that determines certain specific things to the duties of a registered dental hygienist. You have to pass it's basically referred to as the law portion of the exam. So you have to pass that successfully. Also, upon graduating from your an accredited registered dental hygiene program, passing your national exam, and passing your regional exam or state exam, you then have met the requirements to then earn your license as a registered dental hygienist, and you may be called as such. Let's see. I would say as far as the classes can vary. You will be, most programs that I understand now, I would say you do have to take mathematics. Most require you to take at least up to the level of calculus or statistics. You do have to take certain sciences to include biology, college biology, organic chemistry, inorganic chemistry, physiology, anatomy. You will do a great bit of writing also, because there's certain other classes that are non-science related that you have to take. But many of your classes will initially be what's referred to as your prerequisite classes. Those will be taken, if you are in a 4-year program, they are kind of mixed in with your registered dental hygiene courses. If you're taking a 2-year program, those referred to as prerequisites. You will take those in the first 2 years, and then you then will go and enroll into a registered dental hygiene program specifically for the hygiene program, and then you will go ahead and complete those 2 years of the registered dental hygiene program. It just really depends. If you do a 2-year program let's say at a junior college or at a community college, it'll probably be an associate's degree program. So like I said, you'll do your 2 years of prerequisites, and then you will do your 2 years with the hygiene program. If you do a 4-year program, it's all kind of mixed in over the 4 years. It's a matter of preference. However, I would suggest, with having gone through both an associate's and then a bachelor's program, I would suggest, if possible, to enroll in the 4-year program, because I do believe you get a more well-rounded experience. I think it also opens up doors for you on the outside. If you decide that you want to practice clinically, you have that option. If you decide you may want to go into teaching, it also opens that option up to you. Although most dental hygiene programs, if you're going to go back as an instructor, do require you to have at least a master's degree level. Some will accept you with a bachelor's, but most require you to have a master's degree level in dental hygiene. Master's degree education in dental hygiene. Some people prefer to go into sales. Having a bachelor's degree is definitely looked upon more favorably. Some people require that that they may decide they might want to go into research. Again, having a bachelor's degree opens that door for you. There's also the option where some people prefer to go into government-sponsored programs like the United States Public Health Service, which you can commission in as a, usually I believe as a lieutenant junior grade, or as a captain, as a lieutenant. And they use Navy rank structure, but these are programs where if you decide you want to go into federal service, work for federal service, in the United States Public Health Service, that is an option for you with a bachelor's degree, as well as applying for a federal program, becoming a federal employee such as myself. They look more favorably upon having that bachelor's degree, although it's not mandated, it is preferred. So that's why I say, if you're going to look at the two, I would strongly suggest considering a 4-year degree program as to a 2-year degree program. But either way, you'll still receive enough training and education that you can practice clinically in a competent manner, and that shouldn't be a problem finding work with that. What made me choose my career? Well, if you ask my mom, she said it was, I had a natural curiosity of looking at people's mouths when I was a little kid. From the time I could toddle around on the floor, I was asking her, my dad, and everybody, open your mouth, I want to see your teeth. So I guess I had a natural curiosity for that. But I think as I, got older, it's just something I was more inclined to look towards that area of work. It just had a natural fascination for me. Plus, it was the desire to want to help people. I think that's help people in a way where it just, you're one-on-one with the person, you're helping them in a way that you can spend an hour with them and hand them a mirror, and they can look at their teeth and their smile and see that you made a difference and help to improve their smile, make their smile healthier. A healthy smile helps people's self-esteem sometime, and again, you never know how, that person may have been having, let's say, a history of bad oral health or things of that nature, and you can spend an hour with them and change their perspective about their teeth, their mouth, and possibly their opinion of going to the dentist. So you can help people in a really tangible way. So I think that's also one of the reasons why I went into it. And the career field pays good. Again, depending on your area of the country where you live, you can make as little as $60,000 a year, or if you live in a high income area, high cost of living area, and depending on how motivated you are, you can make upwards of, I've made over six figures. So it just really depends on what you want to do and how you want to approach it. Let's see. As far as getting the position I have, usually if you're going to apply for a federal position, there's a website called USA jobs.gov. That's usajobs.gov. Excuse me. All federal service positions, whether it be registered dental hygienist and the like, you have to apply through that service online, put your application in through that, and they'll tell you the requirements that they have for that specific position, which will in most cases be either a 2 or 4 year degree program, 2 or 4 year degree. Also, you have to have your license, as well as experience is preferred. But those are, again, it'll list out the requirements, but those two are pretty standard throughout to any job application. If you prefer to, most people will either work in private practice for a private dental practice, or they'll work in a corporate dental practice, which is what I refer to as chain offices, like you may be in a city or a town where there are like 2 or 3 or 4 offices around the city with the same name. They're basically working for a corporation. Some people will prefer to work for nonprofit. So there are nonprofit agencies such as nonprofit dental clinics that service people in low income areas, rural areas. Some people prefer to work for missions. I've actually had my hand in all of that. Work where they go on missions projects, both here in the United States as well as abroad. I've had the pleasure of, with what I do, I've been able to travel to Jamaica, the Dominican Republic. I've been to Peru. Most recently, last year, I traveled to Africa. I went to West Africa, to the country of the Gambia, and actually was able to practice my profession there. So it opens up a really wide scope of places that you can, apply your skill set. It just depends on what you prefer. Some people even work in pedodontics, which is basically working in a children's specialty practice where you basically see kids all day from as young as 18 months to 20 years old, I believe. That's pedodontics. And so some hygienists decide they want to work strictly with kids. There are also positions with the Indian Health Service if you want to go work on one of the Indian reservations. So it has many applications. Even in the jail, they actually employ through the Bureau of Corrections, employs hygienists all the time. Most of those positions are usually found on usajobs.com. usajobs.gov. They also list their positions on that website as well if you decide you want to work for the Bureau of Corrections in their dental facilities. So again, like I said, there are many areas that you can look at as far as work. Let's see. The best advice I can give to high school students is you have to really be serious about your academics. You have to be very focused, because most dental hygiene programs are very challenging. They take up a lot of your time. So you can't really be trying to split time between a personal life and trying to do all that. If you're in high school, I would suggest first and foremost that you try to attain the best GPA you can, because that's going to give you your best opportunity to get into a program going into college, or it's going to give you the best chance to get a scholarship, which helps to cut your costs, because hygiene programs can be rather expensive, and it just really depends on what part of the country you're going, where you're going to be going to school. So I can't really give a price on that, but they can be rather costly because you're paying for not only the school, but you have to purchase your supplies, while you're in school, while you're practicing, you got to get your instrument packs, all that, all those things are very costly. So if you get a scholarship that pays for your full ride because of your academics coming out of high school, that really helps reduce a lot of your stress, because the program itself can be rather taxing and rather stressful because there's a lot required of you. You're trying to pass your classes. You have certain clinical requirements where you're working on patients. You have to do a certain number of patients, a certain number of different types of patients, and these are requirements that you have to do while you're in a dental hygiene program. So if you can give yourself a chance to get a scholarship, that really helps. But that comes from really being serious about your studies in high school. If you have the chance to take any kind of advanced classes in mathematics or sciences, I would suggest that, because you're going to have to take them when you get into an associate's degree or a bachelor's degree program in dental hygiene. So if you've already taken those classes in high school, if you're seeing them again in college, you stand a better chance of doing well in them. So I would say definitely don't shy away from that. Let's see. College students. I would say you want to definitely maintain your highest GPA. Here's something I will say specifically for people who, if you decide to go to a 2-year program, while you're taking your prerequisites, you want to really try to get that 4.0. If you can get it, keep that 4.0 GPA. Most programs that I understand now are extremely competitive, and they will select you based on your GPA as one of the main criteria, in addition to other things. And if you're trying to compete for a spot, and they may have 30 spots coming up, and they have 28 people whose GPAs are from 4.0 to 3.85, which is a very realistic possibility. You coming in there with a 3.5, you're not going to get in. So you really want to try to do your absolute best with those first 2 years, taking your prerequisites, which are things like your base college math, base college algebra, your trigonometry, calculus, college English, college literature, classes such as that. You want to really, really do well with those classes to give yourself a chance to get into a program. Whereas if you're coming into a 4-year program, those classes are figured in over 4 years, but you still have to maintain your GPA. So it's more challenging because you're having to do your dental hygiene focused classes in addition to your other classes for your minor. So it's challenging, but you want to try to do your best. And the thing is to be focused about what you want to do. Again, for people, once you get into a college program, associates or a bachelor's program, you can't be messing around. You really have to be focused on what you're going to be doing. There is not a lot of free time because there's a lot required of you. If you're a person that really has to have your free time and you want to go party and all that, I would suggest not even starting a program like that, because you're not going to do well. Chances are you won't do well. It takes a lot of your time up, but it's well worth it. Like I said, I've been doing it for 22 years and I have truly enjoyed working in the profession. Let's see. I did touch on that, the different venues of where you can work. So again, like I said, I even working in missions, I think, that was one of my, as a volunteer, that was an incredible experience. I mean, you get a chance to touch people's lives, and these people, when you go on missions projects to perform, preventive dentistry as a registered dental hygienist, you see people, you get a chance to really see people that are in serious need, that can't afford this care but need it badly. And it not only changes, you change their life to help improve their quality of life, but it touches you in a way that it changes you as a person for the better, I think. It makes you grateful. It really makes you grateful. I will say this too. If you're going to be working as a registered dental hygienist, as I said, it does pay well. But I would tell someone, if you're going into it for the money, although you will make money, I would suggest not letting that be your only driving force, simply because you will get burnt out. You would just get burnt out because you'll work, and you'll get burnt out. And I've seen some hygienists that have gotten started, and within 6 years that they want to go do something else because they just, they're working 6 days a week, some of them, because they're just trying to make that money. And For some people, they're wired that way, and if money is your primary, secondary, and third reason for doing it, then go for it. But I would say let really ask yourself, what are some additional reasons that you're going to be doing it before even starting. Um, Also, too, one of the good things too about dental hygiene, if you're working in the private sector more particularly, you can be very flexible. Some people, depending on your financial situation, they only work, and depending on how much you're making, they can live off 3 days a week. So they only work 3 days a week. Some work at 3 practices or 2 practices. They may tell Dr. Jones, "Hey, I'll be over here Monday and Wednesday. You're at Dr. Taylor's office Friday." It just really depends on your setup. So you have a lot of flexibility as a registered dental hygienist. And that's one of the things too that I think a lot of people in my profession like. Whereas if you're working federal employee, Indian Health Services, if you're working for as a United States Public Health Service or one of the other areas too, most government agencies will either hire you as a federal worker or as a contractor. You can also apply for work as a contractor. Some, depending on the agency, sometimes they hire both federal employee and contractors. So if you can't get in one way, you can Google dental hygienist contractor, and it will pull up different contracting agencies that will hire you on to work as a contractor for different government agencies. I can tell you that the contractor positions typically will pay more than the federal employee positions, but you usually will not have the benefits package that you would as a federal employee. So there is a trade-off with that, depending on what your needs are. I've worked for the United States Army. Like I said, I've been with them since 2016. Before that, I was working with the Coast Guard for about 7 years. And before that, it was primarily private practice. But I enjoyed my experience. I really did. Working with the soldiers and the airmen and seamen and all that, it's great. It's really great. And they're a great group. Let's see. The main advice I would say is just determine your reason. If you're choosing a career, whether it be dental hygiene or anything else, just determine your passion. Just determine your passion. What is your passion for doing what you do? Again, some people, money is their main driving force, and that's great. But if you're passionate about making money, yeah, go for it. If you are, if you decide that you want to, do it because you want to help people, that's great. But, let those reasons be your own. Just do some soul searching before starting, because like I said, it's really involved. It's a very involved program, but it's well worth it. I've known some hygienists that have been practicing 40 plus years and they love it. The one thing I will say too, and I just remembered, as an occupation, you have to really make sure that you maintain good physical health. And you might not think so, but because you're doing a lot of sitting and you're doing bending from the waist and kind of turning. If you've ever went and had your teeth cleaned, the person's cleaning your teeth, they're sitting there and they're kind of leaning over you somewhat and working. If you don't have good body mechanics and good technique and good posture, you can start causing over time risk of things like carpal tunnel syndrome with your wrist, back issues, neck issues. So if anyone is thinking about going into the field of dental hygiene, I would strongly suggest that you consider, once you begin practicing, sign on with a good chiropractor. You can get regular chiropractic adjustments. It really helps to extend your career because it helps you to maintain good body flexibility, good posture alignment, spine alignment, good body mechanics. So those things really help. Yeah, and I did my first year out of school and I'm doing great. Like I said, 22 years in, I'm still chugging along. So it's something that's really good to consider. But also, with a hygiene program, some people decide they want to go on to more advanced programs, such as master's degree programs, either in dental hygiene. Some people decide they want to go into public health, and from having a bachelor's degree in dental hygiene, that does afford you the ability to apply for a master's degree program in public health. There are also more advanced programs such as an advanced dental hygiene practitioner or advanced dental therapist. They basically work in areas where they're either low income areas, where there are not a lot of dental offices that are available to people in low income areas, or in rural areas where there are not a lot of dentists available to the people who live out in rural or remote areas. Only certain states recognize licenses in dental therapists, advanced dental therapists, or advanced dental hygiene practitioner. And those are like Arizona, Connecticut, Maine, Michigan, Minnesota, Nevada, New Mexico, Vermont, Idaho, Alaska, Montana, Oregon, and Washington, the state of Washington. Basically, what an advanced dental therapist or advanced dental hygiene practitioner is kind of like a mid-level provider. You provide all the services of a registered dental hygienist, but you also provide some base care of what a dentist would provide. So you do things like extracting teeth, doing some dental crowns, fillings. Patients have cavities. You get to fill teeth and things like that. Not the full scope of what a dentist could do, but it's kind of a in between, so to speak. So you kind of provide that care for them. So that's also something that if you decide you want to go on and do that, that also is an option to you as well. One of the things I will speak about with dental hygiene is that you have to, one of the things that in reference to coursework, I just remembered, they put an emphasis now on what we refer to as evidence-based research, because they're finding that a lot of things with the mouth are related to the health of the body. So they really have you start to learn how to research different things. Patients may ask you questions about, hey, I use charcoal-based toothpaste. How does that help my teeth, or does it hurt my teeth? You have to be able to validate what you're telling the patient. So sometimes you may have to go and dig through some literature. So that's something that's required for you to do too. So these are things that they'll teach you in school, but evidence-based research is something that's really coming into being popular in a lot of programs, because you'll find yourself, especially in private practice, you'll start doing more work in tandem with docs, as far as like if you may have a patient that has bad teeth and they habitually have bad teeth and gums. Why is this patient not getting better? Well, this patient's are diabetic, and their diabetic condition is not being managed properly. So you may have to contact the doctor to get some information to work with the doc on getting this patient's medication right, so that will help their oral health as well as their diabetic condition. So you find yourself kind of at some points stepping outside of the dental hygiene area and kind of working with the medical side of things, because the teeth and the mouth are connected to the body. So everything's, all interconnected together, and they're starting to really go with what we refer to as integrated medicine. So that's a really big thing coming up. And it's pretty exciting stuff, to really get a chance to expand what you know. But anyway, if anyone has any questions about dental hygiene or being a dental hygienist or different areas, you're more than welcome to contact me on Instagram. My Instagram is hashtag #tooth_janitor. That's hashtag #tooth_janitor. And I'll be more than happy to answer any questions that you may have.